You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. So on today's episode, I'm going to talk to you about carpal tunnel syndrome. What I've been doing, I see people, again, mainly for knee problems, but, people come to the doctor. They have questions about other stuff, which is, why I've talked to you about some of these other topics. I see people and they also have back pain. They also have shoulder pain and wrist pain, or carpal tunnel syndrome is another very, very common complaint, that I hear about. So, what do they complain about? So people will come in and, will say, hey, I've been having pain, and most people know what it is. So they'll say, I think I have carpal tunnel, or I have carpal tunnel syndrome. And they'll note pain at night or this tingling, numbness in their hands. And this is all due to compression of a nerve, the median nerve. So primarily what we'll see is numbness of the thumb, your index finger, and usually part of the middle finger, occasionally what we call the radial side of the ring finger. But most people describe it as those first three fingers. And sometimes they'll rub it. They'll rub their wrist. They'll rub their hands. They think their hand went numb. And occasionally, if they have this for a while, they'll come in and say, my hand is weak. But also they'll say, my hand looks skinnier, and you can actually get atrophy of those muscles. And those are late signs. When people are weak, they start, dropping things. They're fumbling with a pen and things like that. Those symptoms are usually there because this has been there for a long time. But more frequently, people will just say that, their hand gets numb or tingly. They'll kind of shake it out, and then those symptoms go away. So why does this happen? And what's going on? So there is this structure. It's called the carpal tunnel. And the carpal tunnel is a tunnel in the wrist. So if you turn your hand over, so your palm's facing the ceiling, and you look at your wrist area, the wrist crease, on the bottom of this tunnel are a series of bones. So these carpal bones that allow you to move your wrist around. And then above the tunnel is a ligament. And this ligament is very tight and taut. And essentially between the ligament and these bones runs the median nerve and a bunch of tendons that control your fingers. And then if that tendon gets compressed or compromised or injured, that can lead to problems with the impulses that travel through the tunnel from that nerve. So we see this in certain repetitive hand injuries. That's where people always talk about keyboards, but certain, using a jackhammer, anything where you're repetitively using the hand over and over again, you can develop trauma to that area. Certain ergonomics, we've talked about ergonomics with back problems and back pain. So certain things that you do, you may have to just change the way that you're doing those things. Pregnant women, we see there's a lot of hormonal changes, and that can lead to swelling, even in the region of that tunnel, and that can put pressure on the nerve. And then other diseases, we see people with rheumatoid arthritis and diabetes that will develop problems with the nerves or problems with the tissue around that area. So, when people come in, we have to give them a full examination. So obviously, people are pretty aware of these symptoms, and we listen to that and go, okay, it could be the carpal tunnel. But we have to examine them because it could be other things. You can have a problem in your neck, and that could be pinching on a nerve, and that pinched nerve in the neck can cause problems in the hand. So if we went all the way down the road to, say, surgery and did a carpal tunnel release, guess what? Your hand symptoms are still there because the pinching wasn't in the wrist. It was actually in the neck. But you can also have problems in your elbow. And then more commonly, there's a similar, maybe I'll do another talk on this, but there's what's called cubital tunnel. So on the inside of your elbow, your funny bone, where you can hit that nerve called the ulnar nerve. And there's also a little canal on the inside of your wrist, again, if your palm's facing up, called Guillen's canal, and that ulnar nerve can pass there. So again, you can have more numbness of your two little fingers, your fourth and fifth finger, and that can be more from the wrist or the elbow or the neck. So again, we have to examine the neck and the shoulder and the elbow and the rest of these hands to make sure everything's okay. And then we'll do a couple tests in the office. And sometimes what you can do is you can reproduce the symptoms. So, and again, this goes into stretching. We talk about the prayer sign. So if you put your palms together, fingers facing the ceiling, and then push your elbows out, essentially in a prayer sign, that's a good stretch that you can do to treat this. And that can sometimes induce symptoms. Or reverse prayer, where you put the tops of your hands together, fingers pointing to the floor, that can cause it. Or sometimes we'll just put our finger over the carpal tunnel and then bring your wrist, flex it up. All of those can sometimes induce the symptoms. And if the symptoms seem like, hey, you know what, this all fits, more than likely you have carpal tunnel syndrome. So there's a number of things that we can do further. If we think the symptoms are mild, and the symptoms are intermittent, and your exam is consistent with carpal tunnel, sometimes it's modification of activity. So if there's something that you're doing repetitively, we can see if you can modify that, and that can help the symptoms. Occasionally bracing or splinting, especially at night, if you're getting more night pain, the wrist will keep the wrist from compressing down on that nerve. We can use anti-inflammatory, so medicines like Motrin and Advil and Aleve, these are ibuprofen and naproxen, can help reduce the inflammation. And then some exercises. So we talked about those prayer and reverse prayer exercises. You can do those to help stretch out that area, and you might give a little bit more space so the nerve isn't being compressed as much. Now, if that doesn't help, we can start to get into invasive things, and occasionally we'll do cortisone injections into that area. So you can inject cortisone, which can relieve symptoms. There are a pretty decent amount of people that get some relief. It's usually temporary, but they can get some relief. And also, if you're contemplating other diagnoses, it's also a good test as a treatment too, because the percent of relief may indicate that's coming from the carpal tunnel area. And possibly if you get partial relief, there may be other things. So this is where we go into tests. And what other tests? Occasionally we'll do x-rays because you're looking for bony changes. And this is one of the times we can see acute carpal tunnel syndrome. If you break your wrist and where those broken bones or the swelling is, it can actually put a lot of pressure on the carpal tunnel immediately, acutely from this injury. And that's the one sort of rare time where you may need a carpal tunnel release more emergently. But usually if you can reduce the fracture and line things back up, usually those symptoms do go away, but it's something that has to be watched. So x-rays are important to see whether or not there's any bony changes in the area, either chronically or from an old injury. And then what's really helpful are these nerve tests. So we can do nerve tests. We usually send people to neurology, and they'll do tests which really help determine, are the changes new? Are they old, acute, or chronic? Are they just from the carpal tunnel? Is there any involvement with the ulnar nerve? Is there any involvement at the elbow? Is there any involvement in the shoulder or in the neck area? And it really lets us know where the problem is. Things like ultrasound, MRI can be helpful, but they're not used on a regular basis. And then let's say all of that goes on. Let's say so you do have carpal tunnel syndrome. There are no other causes in your neck or other reasons for you to have it. You tried bracing, you tried stretching. Maybe you did or did not try cortisone injection, and symptoms are still progressing. That's where surgery can be indicated. And you can do these open. It's a pretty small incision, just right over the carpal tunnel, and you go down there and basically release that transverse ligament. And then the other option is to do it arthroscopically or endoscopically, where you make an even smaller incision and put a little camera in there, and you can release it. Like all surgeries, there's risks. So your surgeon, if it gets to this, we'll talk to you about what those risks are: reoccurrence, other nerve injuries, tendon injuries, along with infection and things like that. And some people can have some pain, usually temporary, just because of a scar. It's usually short-lived, and there'll be a period of protection. So depending on your hobbies, activities, work, you may have to make some changes in that while you're going through your healing phase. But for the most part, most people recover pretty quickly, and the long sort of recovery really comes down to the damage or injury to the nerve, and that's kind of the important thing to understand. If you do have mild to moderate symptoms that are getting worse, night pain, no weakness, no chronic denervation, basically like an injury to the nerve, which has been there for a while, then most of those pains, tingling, numbness symptoms should go away. However, if you do have weakness or more chronic issues, this has been long-standing, a lot of times the release, whether or not we're talking about nerves in your neck or nerves in your back or nerves in your elbow, or in this case, nerves in your wrist, really the big goal is to prevent further damage. So if you leave it compressed, that tingling, numbness, pain can lead to weakness and permanent weakness. So by releasing the canal and opening that space up, you prevent further damage. So there are some people that have more significant symptoms that may not see full recovery back to, quote, normal, and also may have a prolonged period of slow, gradual improvement for up to a year or so. But the majority of people, especially the night pain, is the thing that, we see most commonly. People will say, is relieved almost immediately in most people. Tingling and numbness starts to improve. But weakness is one of those things that may take a long time to come back and may never come back to normal. But also not doing anything can lead to worse weakness that can become permanent. So a whole bunch of information. Previously, I've shared with you a link to the American Academy of Orthopedic Surgery. I believe they have a really good ortho info page with information for patients about certain diseases, diagnoses, and things like that. So I will also add the link to the AAOS sheet on carpal tunnel syndrome, so you can print it out and read some more, read it online and save a treat. And again, if you're having symptoms that are really mild and you're not sure, these are simple things you can try at home, but if your symptoms are more significant and they are not minor and they are not going away, talk to your doctor, see a doctor, get evaluated, and see if it's the correct diagnosis and what other treatments may be available for you. So thanks again for listening. I'm Adam Rosen, your host. You've been listening to the Your Knee, Your Health podcast. Until next time, stay safe. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.